I wrote this story to share what it's like going through inpatient eating disorder treatment. I walked through the large, cold metal doors, which closed slowly behind me and locked with a clank. An icy stab of anxiety shot through me at the thought of being locked in. Here I am, inpatient eating disorder treatment. I thought back to the conversation with the therapist the week prior. I had gone to see an eating disorder specialist. "Have you been restricting your food, Margot?" the therapist asked. "Yes," I said. "Have you been binging and purging?" "Yes." "How long has this been going on?" "Since I was 8, so 13 years now." I was trying to be as honest as possible with the therapist. I wasn't accustomed to talking about my eating disorder. I had worked so hard for so long to keep it secret. Now it seemed strange to be sharing the secret, but I knew I needed help. The therapist regarded me over clasped hands. "It sounds like you have anorexia nervosa purging type." They paused, then added, "Based on the duration and severity of your disorder, I think inpatient treatment is the only way you'll recover." Inpatient treatment? I must have lied. I must have exaggerated. There's no way I need inpatient treatment. My eating disorder isn't bad enough. But the therapist recognized that my disorder was bad enough, and I needed intensive professional help. "Okay," I said, nervous for the next step to come. "I'll do inpatient treatment." So there I was, walking through the doors to inpatient treatment. My feet stopped, and I tried to take a step backwards, still thinking I wasn't bad enough to be there, but I was locked in. To the left was the mental health psychiatric ward, where I would be living for the next month. To the right was the day treatment center, where daily groups and individual therapy sessions were held. Next to that was the cafeteria, where I would get all my meals. The bathrooms had nurses standing guard to prevent patients from throwing up. Everywhere there were locked doors. I felt numb. I couldn't believe I was taking this step. I felt as if I were willingly handing my freedom over, and I was, because I was unfit to care for myself at this point. I didn't know how I had let it get this bad. I used to feel in control of my eating disorder, as if I was choosing to restrict, but I had to admit that my disorder had taken control over me. "Hello, Margot. Welcome," said a kind nurse. "Hello," I answered nervously. "Let me take your stuff and put it in the ward for you." The nurse took my backpack and explained, "You can't have this on the ward because it has straps, but we can give you the contents as long as they aren't contraband." I shuffled along as the nurse brought me into the ward. There were patients everywhere, walking up and down the halls, sitting in the common area. I felt as if all eyes were on me. I wanted to shrink into the floor. "Now let me take your vitals," the nurse said cheerily. "Sit right here and I'll be back in a moment." The nurse grabbed what looked like a computer on wheels and wheeled it over to where I was sitting. "We take your vitals every morning and evening. Your blood pressure is low. That should improve once you're eating healthily. Now let me take your weight." He guided me into a small room with scales and had me step on. Another stab of anxiety shook me at the thought of weight. My weight is too high to necessitate inpatient treatment, but the doctors and nurses obviously disagreed. The nurse made sure to cover the weight reading with his hand so I couldn't read it, then motioned for me to step off. He printed off a hospital ID bracelet and put it on my right wrist. "I'll show you to your room," the nurse said warmly. I carried an armful of my possessions down the hall, following the nurse. Midway down the wing, the nurse directed me to a room on the left-hand side. "Here you are." I stepped inside the room. There were 2 beds, a bookshelf beside the beds. The walls were white and bare. I placed an armful of belongings onto the bookshelf. It reminded me of moving into my college dorm room, but I had to drop out of college due to my eating disorder to do treatment instead. I felt empty as the empty walls. The nurse left, and my roommate walked into the room, a mousy girl with brown hair. "Hi," she said, "I'm Sally." "Hi, Sally, I'm Margot." "What are you in for?" Sally asked, cracking a smile. "Anorexia," I said. "It's still not feeling real." "Bulimia for me," Sally said. "Don't worry, everyone's super nice here. I'm sure you'll settle in just fine." The nurse came back to my bedroom door. "You will meet with your individual therapist and a registered dietitian later today," he informed me. "But now it's almost time for lunch." Instantly, dread shot through me. My stomach tightened and my hands began to shake. I would have to eat. I thought again about the locked doors. We lined up to the cafeteria. I let Sally and the other patients walk ahead of me, trying to delay the time until I had to eat. I haven't even met with a therapist or dietitian yet. How do they expect me to eat a meal? The line moved slowly forwards and trays were passed back down the line. I gripped my tray tightly, my hands clammy with anxiety. I can't eat, my brain began repeating. Finally, I got to the front of the line. The food was laid out in several pans, cafeteria style, and I handed my tray over. I pointed numbly to the food, my brain still repeating the mantra of I can't eat. The cafeteria worker gave me a scoop of each and passed the tray back. I grasped the now heavy tray and turned to follow the line of patients over to the table. The patients all sat around one big table. There was a therapist stationed at one end of the table and a dietitian stationed at the other end. They reviewed the rules for newcomers. Hands had to be visible above the table at all times, so patients couldn't get rid of food by stowing it away in pockets. Everyone had to eat 100% of their meal. If you don't eat 100% of your meal will be supplemented with a boost meal supplement drink. My hands were positively shaking. My brain shouted, I can't eat, but I thought again about the locked doors, and about the therapist telling me I needed this treatment. I began, robotically, placing the food to my mouth, one step in front of the other. Like a zombie, I ate my meal 100%. Sally refused to eat her meal. The dietitian tried to kindly encourage her to eat, but still she refused. Then the dietitian stood and went to the refrigerator nearby and grabbed a boost meal supplement drink. She returned with the meal supplement and handed it to Sally. I could see that her hands were also shaking as she sipped the boost. At least this is hard for everyone. I was both horrified and proud of finishing my meal 100%. I thought again about the guards outside the bathrooms and felt another stab of panic at knowing I wouldn't be able to get rid of anything. After lunch, I was sitting outside in the courtyard, hanging out with Sally and the cigarette smokers on their cigarette break, when the dietitian came to get me. She guided me over to 2 chairs in the corner of the courtyard, and we sat down. She helped me create a meal plan that I would follow. She also told me that eating disorders aren't about food or weight. They're a coping mechanism for deeper issues. Once I was following the meal plan and entering into recovery, the deeper issues would become clearer. We finished our meal and I went inside the day room, where my therapist came to get me. We sat down in a small room together. What brought you to treatment here today, Margot? The therapist asked me. I restrict food and I throw up. Since sharing the secret, it was getting easier to talk about. I want to get better, but I think recovery is impossible for me. I keep thinking I'm going to go back to the eating disorder as soon as I'm out of here. It's quite common to feel that recovery is impossible in the beginning, but recovery is possible. Just keep putting one foot in front of the other, like they say. Fake it till you make it. Fake it till you become it. He continued, eating disorders are maladaptive coping skills, which we use when we don't know better coping skills. Cognitive dissonance keeps them in place. You can thank yourself for doing the best you could with what you had. And you can learn to use better, healthy coping skills to replace the maladaptive ones. The therapist then asked me, how would you describe yourself? I feel like I don't have a self, I said. Is that possible, to grow up without ever developing a sense of self? Yes, that's possible, the therapist paused, then added after contemplation, you get to create your sense of self. Your sense of self is something you create. You can build a healthy self. I had never been told that before. I felt simultaneously shocked and overjoyed at the prospect of being able to build a sense of self, a healthy self. Maybe then I wouldn't feel so empty, and wouldn't feel the need to empty myself of food to feel right. Maybe recovery was possible.